Well, I would argue that part of the reason it's so difficult for us in this country is that we tend to shout at each other rather than talk with each other. It's been very difficult to get a coherent public discussion around this issue. There's a great deal of emotion about it, a lot of it reflecting political positions that people have taken, or concerns about their own health insurance or their own employer and so on. And it has really constrained our ability to address this issue directly. We're pretty good at telling you what the problems are. And we can point to other countries that have found solutions that have so far eluded us. Because remember, we do spend more per person than any other country in the world, twice as much as the average of the industrialized world, and yet our health status is at the bottom of the list of the industrialized world. We rank 37th or 38th in the world in the effectiveness of our health system. So we clearly are spending a lot of money, but we're not getting the benefit for it. If we were the healthiest country in the world, we might say all that money is well spent.
Are we our brother's keeper?
Are we? Well, sometimes we say we are, but we certainly haven't demonstrated that we are in this country, and all of the things we're talking about suggests that there are haves and have-nots in this country with some of the basic issues related to health and happiness. Most other industrialized countries say we are our brother's keeper to the degree that access to health care is a right. Now, we've not made that decision. If you ask me if I think we should be, clearly in my construct, yes, I think we have that responsibility. I'm a public health physician after all. That's what I'm about. So yes, I think we have that responsibility. And what we've been talking about in terms of developing a national dialogue and an approach to this is really focused on accepting that, I think, as a basic principle, or at least seeing whether the U.S. as a group, as a population, will move beyond word service and really accept it as a responsibility and be willing to exhibit the flexibility that will be required for us to actually change our deeds so that they match the words.
Some say that if you want to understand America's health system in aggregate, follow the money. Mm-hmm. What do they mean by that?
It's what I use in my introductory class in medical care organization. In fact, and I say, you know, just as Deep Throat said to Woodward and Bernstein in the back of the garage, follow the money. Because in the United States, the mechanism for everything basically comes back to financial issues. The worth of companies, the worth of this, the worth of that, the worth of the other thing is measured monetarily. And how the money flows through the system and the nature of the flow through the system will determine how things are done. And that, in point in fact, money drives that system. And if people will say, well, why does X? And then my rejoinder is, remember what I told you? Follow the money now. Let's look at the financial implications of that particular question you ask. So whenever you ask those questions about, that seems unusual, go back and look at the funds flow, and it will drive you, if you understand how the money flows, to an understanding of the system. So that, again, in the United States, we value things in money. The stock market, the value of companies.
That's how we keep score, right?
That's how we keep score. I mean, it is the capitalist system that we have made a decision to adopt. We're not socialists, we're neither communists, we are a capitalistic system. And as a consequence, we value things financially.
This television show on the future of America's healthcare system has been funded in part by Del Mar and Cengage Learning. Now, this is an organization that publishes textbooks and other learning systems, and this is the latest textbook, Principles of Public Health Practice, 3rd edition, and wouldn't you know, it's actually authored by F. Douglas Scutchfield, MD, and by C. William Keck, ND, our illustrious guests on the show. Let's talk a little bit about this textbook. Who is the reader for Principles of Public Health Practice?
Well, it's aimed principally at students in public schools of public health and public health programs, and secondarily, but perhaps not a great deal secondarily, at practitioners of public health. Remember, most of the public health workforce has no formal training in public health. They've learned on the job. So we thought about this book in ways that we thought it might be beneficial for some of those folks who want to update skills in particular areas.
Now, the website for the publisher is cengage.com, and you can actually purchase the book at ichapters.com. Dr. Scutchfield, quick commentary on the book.
Well, the book is really intended, as Bill has suggested, to appeal to an audiences, one or two students. The other ones are practitioners in public health and people who might like to learn more about public health and the public health system. I think Bill and I feel very strongly that a substantial contribution, certainly over the last century, to the health of Americans was made not by the medical care system and antibiotics and all of these modern discoveries, but rather just the provision of basic public health services.
We've come to the end of the show, or close to it, but we have time for closing comments from both of you. Dr. Douglas Scutchfield.
The thing that I would close with is one of the comments that I've made consistently, and that is it's important for the American people to begin to talk about the hard decisions that are inherent in medical care. And if in fact this program and its relatives can in fact prompt some of that discussion and begin as a nation to develop that dialogue and discussion and deliberation, which will allow us to move to a new healthcare system, one that is in fact better focused on values that we have as a nation, then we're all the better for it.
This is an exciting time. My professional career has been laced with frustration at the inability of the United States to effectively deal with the health needs of its population. Given our resources and knowledge, that to me is unconscionable. Yet we are now at a time when I'm once again a little bit hopeful that perhaps we're about to engage in the kind of conversation that Dr. Scutchfield has mentioned. I am hopeful that perhaps now the pain and the awareness is reaching a level that we actually might be able to have a productive and useful discussion about what comes next.
Well, that's our show. It's dedicated to everyone out there who has ever not received the care that they need or have not been able to receive the type of insurance coverage they need, or someone who's expressed pain and suffering because of a lack of organization or will within the system. We hope that this show will move towards a fairer and better system for the entire country, and we appreciate the support of persons in conscience from the insurance industry. And of course, we want to thank our sponsor today, the ones who's helped pay part of the cost, Cengage Delmar Learning Systems. Thank you.